All right, guys, thank you so much for coming to this presentation for nursing. And so I'm just gonna go ahead and jump in because I know most of you guys. So we have here Ms. Jordyn Harris, who is a graduate from Northtown Area High School. She graduated in 2019, right before the quarantine. And she was here for a year. And I didn't realize that until today when we talked, because I remember seeing her all the time, which means that she was very actively engaged in a lot of things here. So she was a cheerleader here. And so she reached out to us because she really wanted to come in and talk to you guys about the nursing program instead of having all the other old people that come in here to talk to you guys, right? Get somebody that's a little bit closer to your age that can give you guys some really good advice. And so she had a really good session with the students this morning. So she's gonna go through, tell you about herself, tell you about the nursing program. And then when she finishes, you guys will have an opportunity to ask her questions. You can raise your hand, ask her questions. If you feel weird asking questions, just do this to me and I'll come over to you. You can tell me your question or you can write it on a piece of paper and I'll ask it for you. And then at the end, we'll have a few more minutes if you want to talk to her personally. That's okay. Don't worry about it. If you want to talk to her personally, then she'll do that. All right. So we have Ms. Jordyn Harris and the floor is yours.
Hi guys, how are you? Good, fine. Love to hear it. So my name is Jordyn Harris. I am right now a nursing student. You heard me right, I'm a nursing student. I don't have any degrees underneath my belt. And I'm here to talk to you guys today to talk about my experience in nursing school and a little bit of other healthcare professions as we kind of go along the PowerPoint when it's appropriate. How many of you think you want to be a nurse or work in the healthcare field? I see literally everybody's hands up. Awesome. I love to see it. So this presentation is going to be basically the realness about what I've experienced during nursing school, what I wish somebody would have taught me or showed me going into nursing school. Again, I am not a representative from a university. I'm just wearing my little sweatshirt because it's cold. I'm not a representative from a university. I'm not here to sell you on a dream. I'm here to hopefully that you can decide whether nursing is for you or it's not for you, okay? How many of you guys are freshmen? Do we got any sophomores? Juniors, junior year? Oh, a lot of juniors, love to see juniors. And then seniors? Oh, we got a couple of seniors. We have a really good mix in the house, okay? If you guys feel the need to ask any questions, please just raise your hand and just say, hey, like I have a question. I have no problem answering it, okay? Okay? Hey, cool. So a little bit about me. Ms. Mitchell already said that I graduated from Northtown in 2019. Go Eagles. That was 4 years ago. I feel pretty old. I'm 21 now. I'm a senior year, like I said, nursing student, went in, and then I'm an intern at Abbott and Lansdale Hospital. And then two other fun facts about me is that I actually work at Victoria's Secret and the Fashion Mall, and I also work at Dark House. So between two jobs, full-time school, and an internship, my life gets pretty busy. So we're also going to talk about managing your time during nursing school and how that can be beneficial. I finally, now as a senior, have gotten into a really nice groove with my system. And it's not for everybody to work two jobs and be a full-time student and do an internship, but we'll talk about managing your time later in PowerPoint. Some fun facts about me is I'm an only child to my dad and my stepmom. We live very close to here on Trooper Road. Northtown was a special place in my heart. I was only here for a year, but as you guys know, your teachers and staff love and care about you guys a lot, and they really want you to do well. That's why Ms. Mitchell and I connected, and we were able to set this up for you guys to give you a good experience. So why nursing school? So as much as you guys were like, oh yeah, I want to pick nursing for whatever reasons, nursing school is a 4-year undergraduate program. That means you go through about 4 years to get this degree, which they label as your BSN, which is titled as your Bachelor in Science in Nursing. So with that BSN, okay, you have your BSN degree. You really can't do much with your BSN degree. The real bread and butter is when you pass what they call your license exam, which is called your NCLEX, which makes you become an RN, which is registered nurse. So I do my 4 years of school, get my diploma, I'm going right into now getting my licensure so I can become a registered nurse. Without that registered nursing license, you cannot practice, so it's very important that you pass your boards. Your boards consist of like a 75 to 145 question test that's basically adapted to how well you answer the questions, and then to pass or fail exam. Don't worry, there have been multiple people who have taken this exam 3, 5, 4 times and still and have yet to pass. So it can be hard, but our goal, or our university's goal, is to have you pass them the first time. So this actually is older information. I actually should have probably left it out. So you, right here. So you get your license in PA. It used to be that if you passed your Pennsylvania NCLEX, you used to be able to practice in Delaware, Virginia, New Jersey, and Maryland. That's no longer true. But if you want a license in another exam, say, hey, I moved to Texas, you can just apply for a license in that state. You just have to pay money. You don't have to take another exam. So your starting salary average for a new graduate nurse is going to be $65,000 a year. That's starting out. That is going to be your base pay, and that does not include any extra bonuses. During COVID, I saw a lot of people, or a lot of nurses, getting offers for sign-on bonuses that were like $5,000. $3,000. So it's a really good lucrative field to get into. Again, that's just your starter. There's no, as we talk further on, there's no glass ceiling. You can always keep going up. You can get your BSN, which is your bachelor's. You can get your Master's of Science in Nursing, which is your master's. You can be a nurse practitioner, and you can do so many other things, and you can just keep going and keep going and keep going as your life progresses. Or say you were like, hey, I think I just want to be an RN. That's completely fine too, and you can still make a lot of money. Okay, your options to choose a specialty, I should say. You can do, we're gonna go into specialties later on, but there's so many options and so many fields that you guys can go into that I'm gonna name, and even the some that I don't have on the PowerPoint, I'm still gonna like rattle off as I go through, but there's so many places to fit your personality. Don't ever feel like if you're stuck somewhere that you have to be like, okay, I'm here forever. That's not the case. Okay, you will always have a job. As long as you keep your license, as long as you keep having your license, you guys will always have a job. You will never, ever be without a job. Again, we've learned through this whole COVID process, even computers can do a lot, but they do not replace us as humans and as nurses. And a computer can never do what a nurse does or what a doctor does. So you also receive excellent benefits. So by this, you'll have health insurance, you will have a stable, steady income for your family, you will have eye care, and you will have dental care. Not a lot of jobs offer that, so that's also another thing to keep in mind. So here are some local nursing programs that to keep in mind that you guys may say, hey, I want a tour, or hey, I might like this. My biggest mistake when I was in your seat was that I was touring everywhere without a specific goal in mind. I knew I wanted to do nursing, but I had this like internal fear that if I don't go and seek out all the opportunities to me, I'm not gonna be well. I'm not gonna do well at anything. Don't believe that. There are a lot of competitive nursing programs. Villanova is super competitive. Drexel, Temple, LaSalle, super competitive programs. But when I tell you, if you want to do nursing, only tour nursing schools and only tour schools that have an accredited nursing program. I'm telling you that right now. If you're like, oh, well, I'll just apply to biology because it gets me closer. Don't do it, because I did it and it was a waste of time, money, and it was just a lot. Just only apply to nursing school is my biggest advice. So Bloomsburg, Drexel has a really good one, Villanova. Way, that's where I'm from, go Griffins. We got Holy Family, Temple, LaSalle, Jefferson, University of Delaware, James Madison, University of Maryland, super competitive, and then Johns Hopkins is also super competitive. My mom actually works at Johns Hopkins, and actually I got accepted in Johns Hopkins, but I did not go to Johns Hopkins for a lot of different reasons, it's too far. But it's all of these, and then some more that Mrs. Mitchell can give you some more information on, okay? Anyone have any questions? Okay, so we talked about the career paths of nursing. So these are just some of the few career paths that you guys can go into. So telehealth nurse is basically like what we had during the pandemic. You go to your doctor's office, the nurse basically checks you in. Very, very beneficial, especially for people that cannot leave their homes or are sick with COVID. So it now is becoming really popular. Travel nursing, this is what you probably hear the most of, where people go to a different state for like 13 weeks, they have a travel nursing schedule, so you could be working the same schedule as you would as a regular nurse, but the company kind of brings you into this hospital and says, okay, we got Jordyn here, we're gonna have her work from 3 days a week from 7 a.m. to 7 p.m. Sometimes they might not need you, but you still get paid. Again, one thing about travel nursing, it's a lot of money involved, and they give you money for food, for transportation, for housing. But the thing about being a travel nurse, it's not something you do straight as a new grad nurse. A lot of the times, nursing schools are meant for you to pass your boards. They're not meant for you to have all this bread and butter clinical experience. So it's important that you grab clinical experience from whatever specialty or what area you go into. So don't go out thinking, okay, I just graduated nursing school, let's go into travel nursing. It's not smart, and a lot of people have lost their license that way, thinking that, oh, well, I don't have enough experience, but I want to really travel. Get that experience first under your belt. You really only need a year or two, and then you can go off and get set. So oncology nurse, they're the cancer nurse. A nurse case manager was actually very interesting to me at one point. It's basically the social worker of nursing. So I have a patient on this floor, Mr. Jones. Mr. Jones has all these different disabilities, and he needs to go into a different rehab facility to basically work on his movement. Okay, well I contact different rehab facilities and say, okay, we can accept Mr. Jones, and then I set up the coordination for Mr. Jones to leave. And that's not the only case where nurse case managers do, but it's a very, very it's a very fun career. And they all start out as nurses, so they have that clinical experience to kind of negotiate with rehab facilities. Critical care, ICU nurse. We have nurse researchers if you're into research and science. Neonatal nurse, they take care of the baby. I wanted to be, labor delivery neonatal nurse. I've changed my mind since then. I'll tell you guys what I'm going to be. A geriatric nurse, which is actually becoming very in demand. And it's because we have a population in America where there's a lot of older people and not a lot of younger people. Where geriatric nursing is really successful is Florida, because a lot of people go to Florida, a lot of older people go to Florida. Psychiatric nurse, home health nurse, I actually got to do a home health rotation in North Philadelphia. I got to go into people's homes in North Philly, and I have to be honest, I was very upset. And you know why? I was not going to the best area. I kind of made a little bit of a mistake about it. I told my clinical instructor, I'm not going to go there. It's very dangerous. And then she said, well, how will you not know if you don't try? And I kind of took a step back, and I humbled myself, and I said, okay, Jordyn, get your butt up, go on the highway, and drive from Philadelphia. And I did, and I had one of the best, most heart-touching experiences I've ever had. A lot of nurses won't step foot in that area because they're afraid of getting hurt. So the patients were so happy to receive care that I wanted to go back all the time. So always keep your mind open with things like that. Nurse practitioner, which is basically all of us amazingly heard of an NP. Now that doctors couldn't do everything during COVID, there was a lot of NPs and PAs going around. So with that, you need your MSN, your Bachelor of Science in Nursing, and then you also need your nurse practitioner license. Registered nurse anesthetist. I've heard that somebody wanted to be registered nurse anesthetist. I will get more information about that and get back to you on it. On kind of the steps to go, but that is the highest paying nursing job. Nursing professor, clinical instructor, which is what I want to do. A nurse midwife, a public health nurse, which we learned are so important with COVID. They were the ones that were doing, okay, Jordyn was in one class and she was in this class with a whole bunch of people and she might have potentially infected all these people. Let's go get these people a test. So they were very very important when the pandemic was going around and we had to do contact tracing. A school nurse, which we have a school nurse. I got to do my school nurse rotation at elementary and middle school, and I loved it. With a school nurse, you just need your bachelor's in science and nursing, and you really just got to take an online course and have a certain amount of clinical hours. It's literally that easy, and you can do it online, so it's at your own pace. Labor and delivery nurse, a med surgical nurse, which is your regular run of the floor, run of the mill floor nurse. And then we have our forensic nurses. So if you guys who takes forensics with Mr. Mountain, I didn't know. That was my favorite class. You do? Yeah. It was my favorite class. It was my favorite class at Norristown. And I thought I wanted to be a forensic nurse. I've since then changed my mind. And then cosmetic nurses, so the nurses that give patients Botox. So a little bit about me. I started off thinking I wanted to be a labor and delivery nurse and work with babies. I've now changed my mind. I want to be a hospice nurse and work in the hospice unit and really develop care for hospice patients. And then I want to go get my master's of science in nursing and become a nurse professor and hopefully run my own university. So qualities of a nurse. So as you guys know, what we think of nurses, the kindness, compassionate, empathetic people that are always gonna, really push themselves to really drive patient care. If you have issues with cleaning people up or helping out when needed, this is not for you. Nobody wants to wipe someone's butt, but I say it like this: if you, I had time for patients couldn't wipe themselves or couldn't get bathed, but after the fact when I bathed them and everything was all said and done, the relief and the thank you that I got was worth all of it. It really did touch my heart, and I was like, you know what, I am doing something really positive, and I am doing something great. So keep that in mind. Effective communicator. I did not realize even until this semester how many people you're going to be talking to. You talk to doctors, you talk to dietary, you talk to speech pathologists, you talk to occupational therapists, physical therapists, so many people that you need to learn, what do I say to this person so I can get what I need? How do I convey my message? And then what else can I do to make sure that everything goes right for my patient? So you really got to learn how to talk to people on the phone, in person, and have a good bedside manner. You have to be a good critical thinker. I have to be honest, when I was in nursing school, the questions rocked my world because it wasn't just like, what's the normal blood pressure in an adult? That's not the type of questions they're gonna ask you. They're gonna basically give you a scenario, say, Mr. Jones is showing up to the emergency room with all these symptoms. His blood pressure is this. What do you do next? And sometimes the answer is you do nothing. I do absolutely nothing. Other times you have to know when to intervene based on the information you were given. So it's a lot of critical thinking. And you know what? A really good example I wanted to give this to you. We had a patient, he was going down for a renal biopsy, and he was on this medication called heparin. And the thing with heparin, if you're taking this medication, if we poke you or stick you, you have a really high chance of bleeding out. So if we're doing a biopsy, we're basically cutting a part of his kidney. So I looked at this medicine and I picked up, I was like, we shouldn't give him that medicine, should we? And my nurse goes, you know what, now that I think about it, I don't think we should. Let me call the pharmacy and let me call the renal biopsy team to make sure I can hold this medication. And they said, yes, please hold this medication. It's dire. And I picked that up. I was like, oh wow. So it's the little things like that that really affect your patient's care, and you want to really be detailed and honed in on your patient's care. Willingness to learn. I've seen so many people and nurses not want to learn. There have been nurses 20, 30 years in the game that don't want to learn anything. I've learned all that I can do all. No, that's not how this works. You're constantly, and I want you guys to always be open and ready to learn. You will always learn something new. Every day you're on the floor, every day you're with a patient, you always learn something. And I need you guys to have an open mind to want to learn. COVID has taught us that we don't know everything. Life hits you in the pandemic and you're like, I don't know what to do, and that's okay. But you need to be open to learning the new things. Proud to advocate. So advocacy is one of the big things they talk about in nursing school. You need to be able to stick up for your patient. You are your patient's voice. Sometimes your patient can't talk. So you're sticking up for not only your patient, their family, their friends, and what you really want for their health. One of the things I see is we have older patients who are more towards the end of life, and they are a full code. And I'm always like, which basically means if something dire were to happen, we are going to give our full effort in resuscitating that patient, meaning we're giving you all the work, we're giving you all the medicine, we're giving you all the CPR and intubation if you need it. A tube down your throat to make sure you're breathing. Well, some people might not want that. And sometimes we have to say to patients respectfully, hey, I'm looking over your dad's plan of care from years ago. How will we consider it to meet both his needs and your needs and make sure everyone's happy? So again, advocating is a big part, especially to doctors, because doctors also have a lot of patients. So it's also very beneficial that you work on advocating and saying, well, my patient said he wanted this, or he needs this, or she needs this. Great time management skills, which we're going to go over later in the PowerPoint. If you don't have a great time management plan, or you don't have a planner, you guys need to get a planner. I don't care if you've never done nursing. Get a planner. Get a planner, stick to your planner, write in your planner, get a calendar so you can look at it. It's always in your face. Because I've seen some people get off track with their schooling and everything else that they don't have a planner. So get a planner and learn how to manage your time effectively. And we're going to go through that later. Leadership skills. You want to be a leader, not a follower. And I'm just generic and weird as that sounds. You want to be a leader. You always want to be the one that's always learning, studying, and always answering the questions. It may make you look like a teacher's pet. I'm the biggest teacher's pet, but I'd rather be a teacher's pet than not know anything else. Optimistic, flexible, and then you also have to love helping people. Does anyone have any questions? Okay. Pros of being a nurse. So again, we talked about there's no glass ceiling. You can always go up. It's in high demand, high demand because of short staffing, which we're going to go through the cons. A lot of people are leaving because of this thing called burnout, which basically you're spent, you're done, you don't want to do it anymore. And people are leaving. It's job security as well. And you're able, like I said, to change specialty, and then you have flexible work schedule. So say my nurse always works, she works Mondays, Wednesdays, Fridays from 7 a.m. to 7 p.m. at the hospital. But she can honestly change that and say, hey, I want to work nights, and nights is more money. Weekends earn more money, so you can always change. And some hospitals even let you work 4 days a week, and you get extra pay, and you get more PTO that way, which is paid time off. Cons of being a nurse. A lot of professors did not tell me about the witnessing loss. I have lost children in clinical, I have lost adults in clinical, and I have to be honest, my school did not prepare me for that. They did not say people would be dying. I literally walked in and they were like, oh, your patient's like end of life. And I said, why did I get this patient? Like, he's gonna, pass away. And I always used to go after clinical with a very heavy heart because nobody prepared me for it. So I think my biggest advice to you, nobody can prepare you through loss, but I want you guys to be able, when that happens, to take care of yourself. I had a friend, he had a loss really affect him and he didn't know how to take care of himself. Again, we all experience grief differently, but I want you guys to protect yourself first, okay? Exposure to pathogens, as we know, COVID, my nurse has gotten COVID 3 times and she wears all the PPE. So you have increased exposure to pathogens. It's very physically demanding. It can be very, very, very stressful. Typical hospital work week is you get 12-hour shifts, typically 3 days a week, give or take a few, depending on how your hospital works, those nights and weekends. Sometimes it can be unappreciative, you don't always get a thank you. Bodily fluids, again, if blood, throw up, vomit, diarrhea, and everything grosses you out, maybe nursing isn't for you, but I have to be honest, I haven't seen too many things that gross me out yet, so now. So, okay. Short staffing, like we said, and then limited, not enough resources. And we actually experienced this a lot during the pandemic. We saw a lot of remember when we couldn't find a COVID test to save our lives and we were struggling for COVID tests and we couldn't find one? Same thing was going on in the hospital. I couldn't give my patient a COVID test. How am I supposed to know they have COVID? Am I gonna waste all this PPE not knowing or knowing if they have COVID? So again, sometimes limited resources play a part in your clinic care. So this is what you should do now. So you can go to nursing school. There are a lot of things I wish I would have known before I went into this field. I was once you, not so long ago. I was you not so long ago, and I did not know how to navigate it. No one was here telling me what you should do. I have no nurses in my family. So these are some things you can do now. Take as many sciences as you can. So anatomy, how many of you have taken anatomy or Mr. McCown? Awesome, who's mine. Forensics, another good one, and then physiology and physics is also a really, really good thing to get in. It's just a nursing program to see that, hey, this person's really well versed in the sciences. Okay, she's a really good AB average in the sciences. Okay, we can work with that, SATs are important, but they aren't the deciding factor in whether you're going to get in or not. If you are going for a top-notch like Drexel, Villanova, any of those really big name schools, yes, your SATs play a big part. I was not a person, full disclosure, that scored very high on their SATs. I was a bad test taker because I couldn't sit through a 4-hour test. It's kind of unfair to me. But I was able to, I still got into Temple, I still got into Drexel, I still got into Villanova, and I still got into Johns Hopkins. And it wasn't because of my SAT scores, it was because I had a really nice science resume and because I had a great essay. So SATs are important, but they aren't the deciding factor. Join a nursing medical healthcare club. I don't know if you guys have any in your school right now, but if you guys have joined a nurse, like medical, anything like that, either in or outside school, it can really help you be versed in not only like nursing lingo, but also what's really good in your resume. Someone can be like, oh yeah, she already knows what she's talking about because she's done this program. And again, they're also looking for consistency, not as if you've done chess or if you've done so many different things. They're looking for, okay, this person's been in the foreign language club for 4 years, and they've been in this nursing healthcare for 4 years, and they have this for 4 years. Another thing about me, fun fact, is that I'm fully certified in American Sign Language, and then I'm partially fluent in French. I picked that up. My boyfriend had gotten me French lessons over the internet during COVID, and then I just went through it, and then I got a certification so I could read French fluently. And then American Sign Language took me a year to complete a course in my school, and then I was able to sit to actually take a licensing for my American Sign Language class. So fun fact about me. Try to become a CNA, which is Certified Nursing Assistant, or a patient care tech. You guys can literally go into Einstein and apply and be a patient care tech and get that experience. People who are techs or CNAs have a lot more clinical experience than I did. They had so much more knowledge, they communicated well with their team, and they had a really, really good time. Try to take a CPR class. These are usually required in nursing programs. You get like a little bundle with your university where you have to take a CPR class, get certain vaccines. So try to even take a CPR class beforehand. Talk to as many nurses and nursing students as possible. So a really good tip that I found in nursing school, I would literally go on Instagram, type in the university I wanted, and I would find in people's bios, like, what nursing university? Nursing. And I would DM them saying, hi, my name is Jordyn. I am a senior year student at Northtown High School. Can you tell me a little bit more about your experience being a nursing student here? And 9 times out of 10, they are more than happy to talk with you and fill you with a whole bunch of knowledge that you never heard before, just like me. Bulk up your resume, like I said before. So, anything else you guys want to ask about that? General expectations in nursing school. This is like the general, like, plain for everybody. Go to class. Our classes are extremely long. I had a class, my longest is a 3-hour class, which I have tomorrow. 3-hour class, but I'm telling you, if you miss one class, you miss like a whole week or two. It is beneficial that you show up and you show up on time. Good thing about going to class is that if a professor constantly sees you at say 26, I see you always at 26, I don't know your name, but I always see you sitting there, and you ask them for help, they're more likely to help you than if you skip class and you say, hey, I need help. Well, I always see you skipping class, so why should I dedicate my time to you? So always make sure you go to class, be on time, being punctual is important. Come prepared. Always, even if reading is not your thing. Say if you want, they're talking about septic shock. Research septic shock. You don't have to read the assigned reading. You can look up septic shock in your own way. You can do flashcards. You can read articles. You can do Quizlets. You can look up a video on YouTube. You don't always have to read the designated material, but again, you want to have a little bit of knowledge to go into the lecture instead of just going cold turkey. I don't know what I'm learning about. You kind of have good basics. And plus, if you answer questions, make you look so smart. Studying content outside of class, you need to, I'm going to be straight up honest, high school never taught me how to study. I learned the hard way my freshman year. I had to study really, really hard for everything because I was never taught to study. But everyone's studying looks different. If you're a visual learner, you might be a better reader. If you're an auditory learner, you might be better at listening to podcasts and audios and YouTube. And if you're not, you might be someone who listens to songs or listens to little acronyms to help them out. It's all dependent on you, and you have to find your own way to navigate that. No one's really going to help you. Asking for help and asking questions. There is no shame in saying, I don't know, or I've never learned that. There's no shame, because when I've said that, everyone's like, oh, let me help you. No one wants you to lag behind, but if you never ask, you'll never get your answer. So never be afraid to even pull your friends aside, pull the professors aside and be like, hey, Professor so-and-so, I did not understand today's lecture. Can you explain it to me in maybe a similar way, or maybe you can find time during your office hours? And a lot of times they would love to help you. Following the dress code and hospital policies, we're not supposed to have our nails done in nursing school, but I do cheat because I'm a senior and you're allowed sometimes. And I always make sure it's a light color and no one can see it. But it's the one thing that makes myself happy. When I told my professor that, she went, you deserve to be happy. So, but when you're new, when you're starting out, don't break the dress code. Always put your hair up. Always have your nails neatly trimmed. Make sure you're not wearing crazy jewelry. It's also for safety for you, but it's also for safety for your patients. A lot of long nails hide bacteria, so we don't want that around our patients and introducing infection. So they're for a reason. And also, just another aside note, you are a guest at a hospital, meaning they don't have to have nursing students there. They're not required to. They're there because they want you to learn. So when you go into clinical, you're like, oh, I'm not learning anything. No one's pulling me aside. You have to make that initiative. I always say treat clinical like it's a job interview. Always be moving around. Always asking where I can help. If it's not your nurse that you're assigned to today, ask another nurse if they need help. Okay? You need to take that initiative, because if someone sees you, whether it's your clinical instructor or somebody else, taking the initiative, they're gonna pull you inside for cool stuff. The coolest thing I've seen is someone had a PICC line, which is basically a line straight to their heart, and I got to flush it, and I got to care for the line the whole day because I was taking the initiative to learn. Again, it was on child as well, so it was a very high energy intense environment, and I got to go and do it. It was very, very fun. Stress. I can't tell you how much stressful nursing school is. You will cry. You will say, I don't want to do this anymore. You're going to say, I'm going to give up. You're going to say, I'm not good enough. You're going to say, why am I investing so much time? Why am I sad? Why can't I hang with my friends? But if this is something you really want, those whys where I'm sitting right now won't matter. If they really won't. I am set up to have a career for the rest of my life because I pushed myself. And if you're not a pusher and you can't push yourself, maybe this isn't the career for you, but you need to learn how to push yourself. Also knowing your limits, but it's always going to give yourself a little bit of a push. Knowing your limits, like I said before, you always need to know your tolerance. Where's your boundary? I'm tired, I'm sleepy, I'm hungry, I can't eat anything. Where's your tolerance? You have to find that very early on, because if you find yourself over that tolerance, you're going to be burned out and you're going to be sick and you're going to be tired. Figure out a schedule that suits your needs. Again, I work 2 jobs. I'm an intern as well, and I'm a full-time student. And a lot of people ask me, how do you do that? Well, I make the time. If it's important to you, you do make the time in your busy schedule. But you also make time to sleep and eat. Do self-care thing every day, whether it's literally spending a whole like 15 minutes doing your full skincare, getting your hair done, getting your nails done, spending time with your friends for like an hour at the mall. Do what you need to do to give back your energy. Be present in the space that you're in. I talked about with the last group. So being present in the space that you're in basically means that I am here presenting to you guys. I have everyone's attention. I love it. I have everyone's attention. Everyone's on me. We're in the moment and we're having a really good time. Again, when you're in spaces as in clinical, you want your attention to be there. One, it helps your mind to not distract yourself from everything that's going on. And 2, it makes you be in the moment. It's always good to be in the moment. Set boundaries with your family and friends. I'm 21 years old. There have been times where my friends are like, let's go and party, woo, weekend. But I couldn't because I had an exam on Monday and I had to go get good sleep. And I couldn't have, if I went out and stayed out till 3, 4 in the morning, I couldn't go out, I couldn't have a good test day on Monday. So again, you have to set your boundaries, but always have time for fun. And then be strict about your sleep and diet, meaning like you need to get 8 hours, which is like, that sounds so redundant. And so easy for everyone to say, oh, get 8 hours and eat a good diet. As much as I love Chick-fil-A, I really love Chick-fil-A. And I love McDonald's and I love everything else about the fast food world. It doesn't fuel your body. And everyone's different things fuel your body. But if you do clinical, if you go to school, make sure you have a protein snack and make sure you just have some carbs in your diet to really give yourself the energy to push you. Simulation lab. This is actually a really good sign of a good nursing program. Say it with me. The nursing school. 3 minutes. The nursing school should have a simulation lab. Love it. The nursing school should have a simulation lab. Perfect. This is a really good sign of a nursing school. Basically, sim lab is where you're gonna basically be with these mannequins. We see all different ones in the picture, and you're gonna be with your nursing team. You're gonna say, hey, this is Mr. Jones. We're gonna come in and do some care on Mr. Jones. Do this best care as you would. And your nursing professors and clinical instructors will be watching everybody in the room and saying, not critiquing you, but giving you pointers on what you can do next time to be better. This is a really good setup in nursing program. Clinical experience. These are some of the clinicals I've done on the side. You guys can talk to me about them if you want after the presentation. And then general things that I've said before would be helpful. Another thing, learn how to take vital signs in clinical, be on time, learn as much as you can, and then ask your questions. So if you guys have any questions about the clinicals, that experiences that I've done on the left-hand side, you can always come down and ask me about it. Okay, any questions?
Guys, it's time for questions. Anyone who is on the Google Meet, you can unmute yourself and ask a question, or you can put it in the chat form. If anybody can hear, you guys have any questions?
Jordyn, I have one.
Yeah.
Which maths did you take? You mentioned the sciences we covered, but I didn't take. Which maths did you take when you were?
So I have to be completely honest. I was a terrible math student. I graduated with algebra 1. I graduated with algebra 1 in geometry. I was not a good math student. Now I'm actually a math tutor. So I have to be honest. It doesn't really matter the maths that you take. But you need to if you're not good at something, you have to keep going. You have to keep pushing yourself. I knew I wasn't good at math, so I got a math tutor and I pushed myself to be really good at math. So the maths that I took geometry, algebra 1, I think I took algebra 2, but I think that's as far as I really went. I didn't do a lot of math because math wasn't my strong point until I got older and I really started to invest more time into doing math classes.
And so then what did you take in college?
Well, you only take one math class. You take nursing, math 101, and then you take nursing math. That's it. but it's still a really important part.
So 2 questions from our group online, or 3. Is there any way to get clinical experience at our age?
Yes, there is. Remember when I talked about being a patient care tech or a CNA? What that really means is that you are hired by the hospital, you're an employee at the hospital, and you basically you do patient care, you do vital signs, you do bed baths, you do a lot of different things, and that way you're able to see a lot of different patients. You'd be surprised on the different medical conditions of your patient, and you have access to all that. So you can look, hey, my patient in bed 3 has a PICC line, which is like the line in their heart. Let me talk to the nurse so they know I'm a nursing student, and how do I care for that? And what do I watch out for when I'm even bathing this patient? Like, can you help me bathe this patient? And we can talk about their care together. So you kind of gain clinical experience through being a CNA and a patient care tech. Again, the most experienced nursing students were patient care techs and CNAs.
Okay, second question from online. I'm 17. Are there programs that you are aware of where I could get PEDS experience?
PEDS.
Or PEDS?
PEDS. I have to be completely honest. Well, they opened up the CHOP in King of Prussia. That's a really good place to start. 17 is a little bit harder because you're working with kids. So adults and healthcare workers get very skeptical when involving children. You have to pass a lot of clearances, and those do cost money. But if you go through a university, you will basically get your clearances paid for by a university. So it just depends. I would go honestly, talk to somebody who's in the career facility at maybe CHOP King of Prussia, or maybe a regular CHOP if you're able to travel down to the city and inquire about, hey, are there any positions as a 17-year-old where I can get some experience?
Okay, and then the last question online is, do you think it's a good idea to start as an LPN and then move to become an RN?
That's actually a really good question, because LPNs, to me, that's actually a very good question. I've only had experience I've only been a BSN RN student. I've heard amazing things about LPNs, and there's nothing wrong with starting as an LPN first to get that associate's for the 2 years, and then going to get your bachelor's. But some people actually end up like delaying the fact to get a BSN. They delay. I've just noticed people will delay to get that BSN, and it does take time. It does take money. But if you want to be an LPN and get that experience, another good way to do that 2-year associate and get some clinical experience in whatever area you want.
And what about you guys? Anyone else in here have any questions? Or do you need me to ask the question for you? Because I do.
I saw you raise your hand.
What sciences did you take this?
Let's start from the beginning. Biology, anatomy, forensics, chemistry, physics, earth sciences, and I think I took 6. I made sure I doubled up some years, so I could really get that nurse. I wanted to be a nurse when I was very, very little. So I was like, okay, I'm gonna double up my sciences. Anything? So my clinical experience, I've been to CHOP, I've been in home health, I've been in people's houses. Some people I've went and got to go to the correctional facility, to go to the jail. That was fun. Yeah, it was fun. I was very jealous. Went to the jail, maternity wards, all different types of things. Yeah.
Do you have any anxiety when how you do?
That's a really good question. I'm actually one of those people that I don't get anxiety during what's going on. But the best way to deal with anxiety, if it becomes too stressful for you, don't be afraid to give yourself a minute to go to the bathroom and have a good cry. There's no shame in saying, I'm overwhelmed, I need a little bit of a break to reset my head. Because if you do something out of anxiety, it's going to be to your detriment of your patient. So there's something wrong with like stepping aside. I've gotten a bad test grade in the middle of clinical, and I had to go and cry back for a little bit. But I pulled myself together, and you keep professional, and then you move forward. But that's actually a really hard skill to learn.
Do you have any more information about the nurse?
I'm gonna look up on my phone right after. But I'm like really interested because I don't even know, but I want to look at that for you. Anybody else? Clinical, what it's like? Is it scary? Are the professors nice?
How do you do with like a patient that's like?
Oh, I've had stories. You are, first of all, you're a human and you deserve to be respected. So when a patient is using foul language, and I'm actually very firm on this as a nursing student because patients just think that sometimes they can be unruly and rowdy. Sometimes it really is, I'm trying to help you, but the way that you're talking to me right now is not very fair. Let's find a compromise and let's figure out what you need so we can work together. And it really is that simple of setting that boundary. You should not be getting hit at your job. You should not be getting spit on or anything of the nature. And that is something to encounter. But I'm very firm in my boundaries with my patients where I'm like, hey, you cannot speak to me like that. You cannot hit me like the guy patient kind of caught me on the arm, she's a little old lady. But I was like, that's not nice. It's not nice to hit nursing students. And she's like, sorry, she has dementia. But you need to set your boundaries and really be firm with your patients. And that's what I'm telling you in any career that you go into. You need to set your boundaries and say, I'm not being treated fairly. And you can always say it respectfully. I don't like the way the email came off. I said, is there another way we can work together and find out what's best? It is a great skill to be a great communicator because it keeps your dignity. And it's also the way that you say things. You can really say, hey, you can type, hey, I really don't like that nasty email you sent, or hey, I don't know, maybe the tone of your email was conveyed wrong to me, but I want to make sure we get through this issue and we solve it together, work together as a team. And it's the way that you say things that really can make a difference. Any questions?
Any last questions?
You guys are silent. Maybe because it's like end of the day. Like,
Because you did such a fabulous job.
Thank you. You covered it all. Thanks.
All right, so we're gonna give Ms. Jordyn Harris a round of applause. I guess the bell rings in 6 minutes. If you can just kind of stay here or go if you need to. If anyone wants to hang around and ask her any questions, we'll be here for a little while. So thank you guys so much.
Thank you guys for being here.
And thank you guys for coming online as well.